Hello, Dr. Nettles, and welcome back to the What and the Why with DNA Chef Jay here. And I'm with Dr. Robert Nettles, the Chief Medical Scientist and founder of the Stop and Regrow Revolutionary Hair Regrowth Program. How you doing today, Doctor? Good to see you.
Great to see you, Jay. Everything is going great today. Today better than yesterday. Tomorrow going to be better than today. So you and I, we're all sticking around.
So, to get right into it, because today there's a lot of information. Last week we spoke of testosterone and how it's vastly different. Now, I learned that it's the free testosterone, not the total testosterone, that does the work and provides benefits for our bodies, right? So today, therefore, I'd like us to talk um, about free testosterone and what it does. Um, Recently, I found a study in the National Library of Medicine which says that while total testosterone levels decline on average, and let me see if I'm right here, 1.6% per year, and free testosterone drops considerably faster at 2 to 3% per year. So I found that free testosterone helps us, build and maintain our lean muscle mass, our immunity, also our bone density. And we both know as we get older, both men and women, that's very important. So what else does free testosterone help us with?
Very good question. So the way I like it, you pointed out some of the obvious benefits of having the optimal biomolecular infrastructure, which is found inside your bloodstream. So I would say, Jay, you're an average human. Would you say that?
Well, yeah, I am an average human, yes, but
Okay, so but I'm going to ask you this: the functions, what you do on a day-to-day basis and a week-to-week basis,
yeah,
and just as so you're going to wake up in the morning and you're going to need something, energy, right?
sure. Yeah, it's a
All right.
choice, absolutely. Like I just got done taking my late afternoon, isopure protein, 20, 25 grams of protein. But there's a lot of people out there that's not doing that. So
Yeah.
it's a choice to maintain, that Nile River of ours.
You're right. So that Nile River is going to feed all the cells in your body. So the point I wanted to make was, so imagine you're the average human,
Yeah.
okay? You're going to wake up in the morning and you're going to need energy. You're going to
Mm-hmm.
want to get up and you're going to want to be productive. You're going to want to make your mind function so you have clear thoughts. You're going to want the muscles to work so that you can mobilize your body, right? You're going to be eating throughout the day, and then you're going to maybe exercise. So you're going to want to have the right chemistry to be able to maximize the muscles inside your body. And then at night, you're going to want to calm down, right? You want to relax if you had a stressful day. So you're going to need the right chemistry for that as well. And then you're going to need to be able to sleep at night. Well, before you
Mm-hmm.
sleep, if you've got a partner, you're going to want to have a sexual relation, perhaps. So all of those functions inside the human body in an average human's day will be affected by their overall chemistry. So you
Right.
mentioned one of the obvious biomolecules, free testosterone. But what I want you to really think about inside our office is we're managing 5 and 6 ratios of numbers of hormones inside your body so that we can have all of the cells function optimally in all of the facets of your day, each day, week in, week out, month in, month out, and not have a lessening or a drop off of that peak effect, which happens after the humans reach a certain age. A lot of those, as you mentioned, those numbers decline. And I think what I learned, you mentioned the percentages per year, I think it was 14% per decade, which probably is pretty close to the numbers that you recounted or recited. And as you mentioned, it wasn't necessarily the total testosterone. I see sometimes a 22-year-old with a 300 level total testosterone, which would be the level of an 86-year-old. So the totals matter, but also the free testosterone versus or in ratio. So it in an absolute number is less valuable to the clinician than the absolute than the ratio of the free testosterone over the DHT or the dihydrotestosterone version, which is the free testosterone with an extra 2 hydrogen ions on the testosterone. Those 2 hydrogen ions change the shape of the testosterone molecule. So think of a key that inserts into a lock. You just change one of those small pieces of that key, and you know how keys work. That key's not going to work as well as the other keys. So it's about understanding those keys that open up all of the functions of the human body. And you alluded to some of them, which are a few cells in the body.
Well, that's why that biochemical report card is so important, is to, check in and see, what's happening inside, because, we all know now that, hair loss is just a cosmetic indication of something that's unbalanced within the body. So we want to, have a look at all those things. So, you can make the adjustment if it's the inherited enzyme, defect, that there's 2 of them, whatever. We already went into that previously, but there's also other things like, for example, I know in your practice you do great things with correcting that enzyme defect if it presents. I know you did it with me, and the topical works amazing, and you do amazing work with hair regrowth, which also leads into like you said, more vitality, more libido, more just brain function, less fluctuations in blood sugar. But you also work very closely in your office with hormones, which is often related to these enzyme defects. So I know that besides the hair stuff, I know you also provide hormone replacement therapy. So aside from repairing enzyme defects, rebalancing hormones that allow your hair to regrow, your office can also use precision medicine to energize and my endurance, my wellness, my immunity. How does that work?
Right, good question, Jay. So the first aspect of precision medicine is identifying the underlying causes that are contributing to the imbalances that are going to be evident in the biomarker report card that we assess. Once you identify the enzymatic deficiencies, which are most likely genetic, those can be supplemented and repaired with a precision oral supplement based on what we find in the blood work. Now that'll bring you back to what's called a normal state. So as a human, you go from a defective state back to a normal state. But your normal state will still go through the normal aging process for the normal human. So as you get older, those, as you recited, the total testosterone values will decline, and precipitously, the free testosterone derivative will decline. So the office can look at all of those numbers after the enzymes are repaired, and because that once the enzymes are repaired, your body will then reformulate and recalculate a more improved hormonal axis. So you will get an optimal, an improvement in the hormonal axis just based on the repair. But you're not going to find optimal, right? You're not going to find what our clients call the Superman's cape.
Yep.
You're not going to find peak function. And what you may realize or may not have realized, Jay, is a lot of people have never functioned at a peak level because even at their 20-year-old levels, they weren't optimal. So if you never started out optimal, you never got to find Superman's cape.
You'll never know, and you'll never know your full potential. Absolutely.
You'll never know your full potential.
So I know
the young men that have maybe were athletic and developed a little bit better. Now those people remember what it was like to feel good. Now, those are the first to walk into the office, Jay, to start back on the hormone restoration because they say, I played professional hockey, and now
Yeah,
I'm not feeling the same. And I played college football, and today's
yeah,
not the same. So it's the peak level athletic men and women that usually understand what it felt like to be peak. Now,
yeah.
some of those, the CEOs and the desk jobs and some of those white collar positions, maybe those bodies never fully develop from the hormonal axis being optimized from the inside. They would
Yep.
never know what it felt like to have Superman's cape, as Brian's mentioned. But
Oh,
that first starts with the blood work and finding out where you are as is, and then where naturally you can improve to be, and then where the optimal ranges could be if you wanted to necessitate a program. And you alluded to the program. We've got a topical that makes sense. The topical will work as a growth agent. The capsule will maintain your internal Nile River, which will improve the health of the cells. And then an
yep.
injectable version of the testosterone is the safest, most effective way to get the precise amount into your body. Women usually do this injection once a week, and the men twice a week, based on the half-life inside the gender-specific human body.
Now, I know, as you know, in the human condition, people like to overdo it. Some people, I know you work with a lot of athletes and bodybuilders. Some people, overdo it with testosterone supplementation, and this can cause negative impacts on our bodies if it's not managed. So, can you tell us, like, what happens if someone takes too much testosterone?
Well,
Like,
you're right.
will you stop producing your own testosterone if you're taking all these supplements without proper guidance?
Well, Jay, you mentioned without proper guidance, there are a lot of things that could go wrong. And one of them, you could put in too much. We had a patient last week that had been on testosterone therapy for close to 5 years and had never really felt anything that thought it worked for him. When we tested his blood work for the first time, we noted that he had no testosterone increase inside his body. So the injectables that he was receiving didn't have the correct bioavailable version of the testosterone. So although
Sure.
he was injecting at the required times, the testosterone he was injecting was not bioavailable, so it wasn't producing any benefits for him. So if you put in too much, you can cause your body to shut down. If you don't put in enough, your body's never going to feel. So it's not just the testosterone. You have to, as we talked about, manage the hormonal axis. And part of
Yep.
that is influenced by the nutrition. So we have to manage our HDL intake because that will influence the total testosterone, and the protein levels will contribute to the amount of testosterone that can convert to the free testosterone derivative. So we're managing 5 and 6 different biomarkers inside a bloodstream based on nutrition, capsules, injectables, as well as the top.
Yeah, there's two things I want to close on. I think you'll get a amusement out of is the things I hear the most doing the consultations is one, I don't have genetic hair loss in my family. All right, which is to me funny because it doesn't matter, if Aunt Sally had it or Uncle Joe had it 2 generations ago, because it may be something totally unrelated that isn't like it doesn't matter what that cause is, if it's that genetic enzyme activity, if it's diet lifestyle, if it's something else that's more serious, but you test for all that stuff. But and the other thing that I thought was interesting for you'd like to hear for feedback is people believe that they're using these topicals, these DHT blocking topicals, and so they're not understanding that it doesn't matter where the cause came from, but the cause is only identified during that blood work from the research. And once you get those numbers back, then you can treat the cause. And I asked someone, I said, you're living in LA. What are you driving? He goes, oh, BMW 3 Series. I said, okay, nice. I said, what was the last time you put the car in the shop for this routine maintenance? It's like, oh, just a couple months ago, it's running great. I said, well, I bet you paid a pretty good amount for that, that car to get maintained. So like when paying for your blood work out of pocket or getting the report card, it's a drop in the bucket compared to getting your BMW put in the shop for maintenance. And it's more important because that's just a machine. We're talking about, I mean, that's not going to last 100 years like we are.
You're right, Jay. The body's a temple, and it's up to us to take care of it. So I think thanks for the feedback as far as the information that
Yep.
you received from the phone calls. Number one, I think the first thing, as far as genetic, when someone says it's not a genetic, I would reframe the cause as an enzyme defect. The enzyme defect could be genetic, it could be nutrition, it could be environmental, it could be unluckiness. So I
Yeah.
think if they've got hair loss, it is an enzyme defect.
Sure.
So let's get the blood work to find out the ratio that needs to be repaired. And
Espe-
I think
Yep. Sorry to interrupt. Especially after all these COVID boosters and everything, we've been getting a lot of people saying, "Hey, I'm having some side effects." So like it could be lots of different things. That's why that test is so important. It's on the website. It's on the Instagram. Just do a consultation, with somebody, get the blood test done, and just stop any more laws and find out the cause and treat it. It's that simple.
And the second question that they brought up was the DHT blockers. And
Sure.
as you're well aware of by now, we educate our patient clientele, and most of our patients, I would say, are high on the science scale. Those are usually the ones that find the precision science field. So we have a lot of doctors, biochemical engineers, mechanical engineers, accountants, lawyers. So there's no such thing as blocking DHT. So even though the buzzword out
Yep.
there is that DHT causes hair loss, Jay, let me be the first to tell you DHT does not cause hair loss. There's an
Sure.
imbalance of up to 4 or 5 different hormones inside your body that can influence the receptors inside the body to either be in the state of growth or the state of miniaturization. So you
Yep.
cannot block. There's the first law of thermodynamics, and we apply that to the human system, and we teach and educate how you can transform molecules, but you wouldn't want to block something if you don't know which direction you need to go. Because
Absolutely.
once the DHT is blocked, it will go back into a portal where it can go up to 3 different directions. So you
Hmm.
need to find out which one needs to be a stop sign, which one needs to be a yield sign, and which one is the green go, okay?
Yeah, and the one thing I learned recently as well is these repackaged finasteride programs. If you haven't been tested, via blood work, and you don't know which of these inherited enzymes you may have, to take that haphazardly without a prescription is pretty negligent because you can increase your estrogen levels. You can put your hormones out of alignment if you don't know what you're treating and you don't have the specific dosing. So that's why again it's so important to get that test done and to kind of recheck in and see where what's causing it and how you can move forward and treat it.
It's shocking today, Jay, as you mentioned, that Propecia and finasteride types of capsules are approved to be used for hair loss indication. And the hormone axis has been known for up to 50 years. So it is known. So I imagine there's going to be some, I think there are lawsuits. The finasteride and the Propecia do not cause the side effect, but they will contribute to that effect in 1 in 5 young men out there. So a lot of people come to us after trying the finasteride and the Propecias and having those side
Yeah.
effects. So if you've got any people that have tried the finasterides, number one, it's not going to be effective. And number two, it could lead to the untoward effects. So I think if I were taking that or had been taking that and had side effects, I would come find the biomarker report card and
Yeah.
find
Well,
out if you truly have one or two defects, genetic or not.
yeah, and we often get these guys at the end of the line. They tried it all. They've, it. So that's why we try to get the word out there. But yes, stopandregrow.com. There's right, on the landing page is all the information. Dr. Nettles, thank you so much for your time. And we look forward to answering any comments or any questions that come in. And I'm sure we'll have something interesting as well to move forward into next week.
You got it, Jay. Now, I know that some people have contacted our office, so you may be aware. The LA Weekly, one of those largest platforms over there in Los Angeles, California, did a interview on precision medicine, and they highlighted Stop and Regrow's hair regrowth guarantee. So the
Okay.
LA Weekly platform, so if anyone calls in there, I don't know if the LA Weekly's offered them $100 off once they got started on the
Okay.
program, but they may have offered them the $100 off. And the Alabama interview show went out as well, and we've gotten a lot of feedback on that. So if there are
Okay.
questions or asking about who won, we had a contest. I think people are aware on your channel, but there was a big
Okay.
nationwide contest, and we have some winners there.
All right. Well, we'll put both links up at the end of this video when we put it up. And good doctor, we'll check in with you next week. God bless. And thanks for joining us. Take care.
You got it. Thank you,
All right.
Jay.
Bye-bye.